So today we'll be discussing about a very interesting topic, that is anaphylaxis or anaphylactic shock. Now, the thing is, anaphylaxis or anaphylactic shock is a basically hypersensitivity reaction. So this is type 1 hypersensitivity reaction. Type 1 itself means that this is a very severe reaction and it takes seconds to minutes to appear. So most important thing is this is a hypersensitivity reaction. So that hypersensitivity reaction can be almost to anything. It can be to a drug, to a painkiller, to the antibiotic, to IV fluids, or it can be anything. Most of the time what we clinically see is it is an hypersensitivity reactions to antibiotics, injection iron, injection vitamin C, or any other injection. So we have to be very careful. One of the most important thing is the dose required for this hypersensitivity to come. So there is one dose called a sensitizing dose, where the symptoms can be pretty compared to lesser and less life threatening. And the second dose, which we call it as shocking dose. Shocking dose is that dose which is the amount of that drug or that particular antigen which is required to produce a severe life threatening reaction, which is we call it as anaphylaxis, which can be definitely life threatening. So shocking dose is maximum when it is intravenous. It is compared to less life threatening when it is intraperitoneal, and it is least when it comes to the intradermal dose. So, intraperitoneal or subcute, they are less shocking, and least shocking it is intradermal. That is the reason we always advise to give injection iron or any other antibiotic intradermally first, so that if there is hypersensitivity reaction to that particular drug or a substance, then the life threatening reaction can be minimized if it is possible. So we know as soon as that drug or substance comes, which is an antigen means any substance which actually produce a severe immunological reaction. So as soon as that antigen enters into the body, that can be subcutaneous or intradermal or IV, a huge IgE mediated reaction appears. So there is huge degranulation of mast cells, basophil cells, and eosinophil cells as well, to have a very bad cascading reaction where the symptoms of anaphylaxis and anaphylactic shock may develop. Now, what are these anaphylactic symptoms? Most of the time, the earliest thing is intense itchiness of all the body, that may start in hands, arm, scalp, face, legs, whole body. There can be a rash, there can be urticaria, and the patient may have intense rash that may be seen all over the body. There can be uneasiness, there can be chest pain, and there can be difficulty in breathing or shortness of breath. Now this shortness of breath can be because of two things. First is patient may have intense bronchospasm, and the second thing may be the patient may have intense uh, laryngeal edema. So these two things the patient can have. So as soon as the patient has these symptoms, what very commonly happens is the other symptoms also may appear, which can be nausea, vomiting, abdominal pain, and diarrhea. But most important bad symptom which is there is the shortness of breath. And second most worsening or frightening symptom is hypotension, because As soon as the hypotension is there, the patient may have loss of consciousness, patient may simply collapse, and patient can have cardiac arrest as well. So it's very interesting to see for these symptoms, and such patients who complain of uneasiness, itchiness, their blood pressure should always be measured, their saturation, heart rate must be measured, because the patient may have bradycardia, the patient may have cardiac sinus pauses, cardiac arrest. So, how do we treat it? It's very simple. The most important drug for this symptom is injection adrenaline. So, adrenaline is the only drug of choice whenever hypersensitivity or anaphylaxis or anaphylactic shock is there. We know that injection adrenaline comes into zero point 0.5 ml injections, and it will be in already a dilution of 1 as to 1000. So what we give this injection subcutaneously or intramuscularly. Most of the time the earliest is intramuscularly. We have to give it in anterolateral aspect of the thigh. So we can repeat it every 2 minutes till the patient's blood pressure return to normal, or till patient feels better. So spasm, that is bronchospasm, is very important to see. Laryngeal edema is very important to see. Saturation, heart rate, blood pressure, and patient's respiratory rate is extremely important. If the patient has laryngeal edema, it can be very difficult to intubate the patient. In such scenario, patient may have to undergo emergency tracheostomy that could be life saving to the patient. So this was all about the anaphylaxis and anaphylactic shock for today, and thanks for your kind listening.